Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thanks for joining us. There's a Facebook campaign that's doing a lot to spread the word about a rare but very serious liver disease known as PBC. Here to talk about this disease is Dr. Jennifer Pate, Chief of Psychiatry at Baylor St. Luke's Medical Center. Welcome to the program, and thank you so much for taking the time, Dr. Pate.
Thank you, Neal.
First, tell us a little bit about yourself and a little bit more about this liver disease called PBC, what it is, and why it's important that women in particular know about it.
So PBC stands for primary biliary cholangitis. It's an autoimmune liver disease that impacts about 1 in 1,000 women, typically between the ages of 30 and 50. And this is an autoimmune disease wherein the immune system attacks and destroys the small ducts in the liver. So without treatment, this can progress to scarring, cirrhosis, death, or the need for liver transplantation. Luckily, we have two very effective treatments that can often stall the progression. And then we also need to be managing the symptoms that come along with this disease, most notably itching and fatigue.
When was your first encounter with PBC?
My first encounter was 18 years ago, and that was with my own personal encounter. I had some abnormalities on my blood test, went to a liver doctor to get it checked out, had a liver biopsy, and found out that I, too, have PBC. Luckily, I have responded quite well to medications, and we suspect my disease has actually improved with treatment.
Is a biopsy the only way that you can diagnose PBC?
No, in fact, a biopsy is often not needed. It is typically diagnosed by routine lab monitoring, like you may have at your annual physical with your doctor or your well-woman checkup.
How does this impact you on a psychological level, enabling you to help some of your patients who may be dealing with the same thing?
I actually consider it an asset in my practice because when people come to me and they describe the type of fatigue that they have with PBC, it's a fatigue that is not improved with napping. It doesn't improve with a good night's sleep. In fact, there's very little that improves it. I am at an advantage with my patients because I can understand that concept. So I feel like my own disease process has made me a better, more confident, and more compassionate physician.
Does this condition affect men at all?
It does, but rarely. There are some cousin diseases, such as primary sclerosing cholangitis, that are a little bit more common in men as compared to PBC. But both of those are autoimmune liver diseases wherein the immune system attacks the liver.
Let's talk about your involvement in this this campaign, this Facebook campaign, the Live Her campaign. How long have you been affiliated with this awareness campaign?
I have worked with the various entities on this for about 1 year now, maybe a little bit more than that. And I've done different video educational projects that can be found under my PBC coach on the internet. The current Live Her campaign, spelled Liveher, is a photography campaign where you can see some beautiful pictures, videotape, and also learn more about some patients' stories. The other thing that we have is livingwithpbc.com that has additional educational information as well as some additional patient stories. This is really important to get the word out because being such a rare disease, patients often feel very alone and overwhelmed, and it's really important that we get the word out that there's support available and there are effective treatments that can stall disease progression.
When you're speaking with one of your patients and they're dealing with PBC, how do you handle the psychological aspect of having been misdiagnosed? I mean, it's a liver disease, and many people say that they have been wrongly, judged or even diagnosed as having maybe a drinking problem in the past, or maybe even currently. Family and friends don't understand, and sometimes their physician is in error as well.
That is so very common. In fact, when I was going through this on my own, I was at the end of my medical training, and when I learned that I had cirrhosis, my first comment to my liver doctor was, I don't drink. Mm-hmm. And he said, I know, this has nothing to do with drinking. So it's really important that we get the word out that, you know, people with liver disease are not just people with alcohol or substance abuse issues. And what I like to do is do a really thorough interview and look at how the disease is impacting their quality of life, whether it's fatigue, itching, depression, anxiety, chronic pain issues. And I like to be very proactive in managing the symptoms so that people can be as functional as possible.
And how has it affected your personal relationships at home? You say your disease has been a little bit on the upswing, improving a bit with your treatment, your ongoing treatment? Yes,
it absolutely has. And I also struggle with some other serious medical issues as well. But, you know, a lot of this is learning more about yourself and managing your time in the best way. And so my family and friends know that inviting me out to dinner is probably not going to work. I'll go to breakfast with you anytime. Mm-hmm. And a lot of times you just have to train your family and friends about what works best for you. And so luckily I'm very functional, and my top priority is doing well for my family and doing the very best I can for my patients.
Great. Well, we'd like to learn some more. Where can we learn some more about PBC and also about maybe yourself and Baylor St. Luke's Medical Center?
Sure. So there's a website called livingwithpbc.com with great resources and patient stories. And then on Facebook, you can go to the bar and just type in Live Her. It's LIVEHER. If you're more interested in my personal story, you can Google Jennifer Payton Fox News. And you can also go to Baylor St. Luke's Medical Center and look at the liver transplant program.
Thank you, Dr. Pate.
Thank you so much, Neal. I really appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at hpr.fm and at healthprofessionalradio.com.au.